Dr. Josh Gatz is a pediatric sports medicine physician at Children's Hospital of Michigan. He's concerned with a trend he's seeing in his practice with children and their physicality.
We're starting to see a lot of kind of muscle ailments, soft tissue ailments from kids who are particularly inactive. We're starting to see kind of muscle knots, muscle spasms, things that we might typically see in adults.
And this is specifically coming from, you believe, the positioning in which they are on a screen.
I think it's kind of multifactorial, definitely one of them.
Dr. Gatz says he's seen kids in the ER after they've fallen asleep while looking at a tablet, only to wake up and not be able to move their neck or their arm. It can lead to missed days of school and even physical therapy in pediatric patients.
We're starting to see these types of ailments where they're having limited range of motion, they're uncomfortable in school, it's starting to affect their daily lives.
Donna Dotson is a senior physical therapist at Children's Hospital of Michigan.
We're seeing kids with difficulty with focus and attention, seeing many kids with issues with visual tracking, which impacts your general functioning and then particularly with reading. We're seeing kids who have just delayed development, delayed walking skills, delayed crawling skills, delays in sitting ability, delays in communication skills, increased anxiety because of screens. And so these are all areas that are impacted by an excessive amount of screen time.
And you've been doing this for 30 years and you feel like you're seeing it more now than you were, maybe 15, 20 years ago.
Absolutely. The screen time for our population in general has been steadily increasing over the years, but the COVID lockdown kind of pushed everybody over the cliff where everyone got in the habit of relying on screens and spending a lot of time on screens. And so particularly since then, we're really seeing a lot of kids, most kids, frankly, that are getting too much screen time. And so it's become such a crisis, and it's really frightening the effects that we're seeing, so that we are now having this discussion about screens with every family that we see. It's something that we talk about.
Dotson says many families don't realize screens are even a problem. And not only that, some have forgotten what to do when there's not a screen involved, and how developmentally appropriate it is for kids to be, well, kids.
For example, when kids come here, I don't want them sitting quietly, well behaved in the waiting room on a screen. They need to be trying to climb on the furniture and the parent having to say, no, you can't do that, you have to sit down, and trying to run around and no, you can't run in here, you have to walk and you have to stay here. And those are practice opportunities, because children's development doesn't happen because time passed. It happens because they had a lot of practice. And those are opportunities, natural opportunities in the absence of screens, to practice self-control and following directions and sitting still and paying attention to the world around you.
Medical professionals are asking parents more specific questions about their kids' use of screens and providing information on how much screen time children should have. But most of all, they're encouraging more play.
In Michigan, it can be a little difficult when it's cold, but even still, finding potentially youth sports in the winter, things like that, to stay active. Even just 30 minutes, 6 times a week, one thing every night, even just going out for a walk around the block with the family, trying to get away from those screen times, just being active.
Dr. Tiffany Widener is a pediatrician at Children's Hospital of Michigan. She's concerned with the number of children she's treating for bone and muscle ailments. Ailments, she says, are usually older people problems.
Especially around the spring and summer when they're starting to become more active, they start complaining about their knees and their backs and their necks because they're having a lot of pain because they spend so much time looking at screens. But usually you'll see this with your older populations because they typically live more sedentary lifestyles.
The effect of too much screen time is not only physical. Local psychologists are also seeing the effects in children mentally. What types of psychological effects are you seeing on children that come into your practice that are using a lot of screen time?
Well, a few things. One, I see them to be more isolated socially, so they're by themselves on the screens, iPad, phone, earphones in, so you can't interact. So the kids are often by themselves. The social skills is an issue too, because if you're not able to interact because you're all into whatever you're doing, the opportunities to be social and to learn are not there.
So, what do we as parents need to do?
So we need to get back to doing things as a family and as a group, because it has to be replaced with something else. So board games, what happened to family game night? Playing cards, Monopoly, Chutes and Ladders, whatever you have, we need to go back and get those things that we stopped buying because we had our screens. But even implementing family screen time. So those family-friendly movies, and then having discussions.
Set a good example for the parents also to put the phones down during mealtime and make sure that you're doing what you're asking your kids to do, is like to talk to you and to be engaged. That means you have to put the devices down and actually talk about things or play with them. Maybe they're bored and you would like them to find something to do, but if they're having trouble because they spend a lot of times on screens figuring out what else to do, maybe get started with them and do something with them and show them how to play or how to pick up some other things to do other than electronics.
So not just having empty screen time where no one is having a benefit from it, but utilizing that in a way where you're engaging your children.